Thank you everyone for joining this PATHw Asia Virtual Roundtable today. We have an amazing lineup of experts for you who will be who will be sort of speaking on the subject through the two different sessions which we have. And also we have an amazing lineup of registrations. We have more than 160 registrations for the panel per se. Before we go formally start up, I would like to take the opportunity to basically set some housekeeping rules. During this virtual roundtable, we will be conducting 3 polls, and I would like each and every participant and attendee to be a part of it. You will see a pop-up on the screen when the poll comes up, and would really encourage you guys if you could answer all the questions for each of the 3 polls which we will be conducting today. We also will have 2 Q&A sessions of 15 minutes each. Each of them will be after each panel, so do wait for the session to get over, but use the Q&A box which is there in the bottom of the screen. Put in your questions there, and I'm sure our experts will be more than happy to answer that, and it will ensure that the conversation is much more inclusive, and we would like to really sort of hear from all of you on the same. We'll also be recording this whole event, and the recording, once the event is over, will be available on the different digital assets of PATHw. We also will be conducting a post-event survey after the event is over. We would like our participants and delegates to definitely use that as an opportunity to provide perspective and a constructive feedback, which will help us ensure that our following up events are much more meaningful, and we are able to really drive the right conversation. Also, I think quite a lot of you might be aware, but this is the Migraine Awareness Week, and we would like for you to support the healthy workplace and to highlight chronic conditions like migraine. Do share the PATHw event on your social media handles. We really encourage you guys to use your Twitter handles, your other social media handles to talk about this event per se, but also about migraine as a chronic condition. The hashtags which are being used is hashtag healthy workplace, hashtag PATHw, hashtag MAW 2020, which is a short for Migraine Awareness Week 2020. I can see more and more people sort of joining in. I would also like to thank Philippine College of Occupational Medicine for providing credit of 10 CME points for this roundtable. This really was a great gesture from their side, and it will really make this event much more meaningful. With that, let me thank again all of you to sort of be a part of this thing. Look forward to some really interesting conversation. And with that, let me pass on to Tyler to lead the conversation from here.
Thank you, Aman. Can everyone hear me okay? And if we go to my first slide, thank you. So it looks like we have a poll question that just came up. Great. Well, good afternoon. And on behalf of Great Place to Work, Singapore and Philippine offices, we appreciate the opportunity to open today's program. There's really important overlap between our work at Great Place to Work and that of PATHw. We are also about creating healthier and better workplaces in Asia, and that it was true both before, during, and after the COVID-19 pandemic. So in my introduction, I want to provide a high-level view of the practices of great workplaces, which I hope you will agree have a strong correlation with also being healthy workplaces, both physically and mentally. Let me begin by taking a minute to introduce Great Place to Work. Next slide, please. So our mission is to build a better world by helping organizations become great workplaces for all. And the for all was added to our mission recently to call out the importance of diversity, inclusion, and belonging in the workplace. Next slide. There we are. At Great Place to Work, we are experts in building great workplaces, leveraging over 30 years of research and experience around the world. We are dedicated to helping leaders successfully navigate issues of trust and performance within their workplace cultures. Next slide. So what makes a great workplace, and how does it make for a healthier workplace? Here you can see our Great Place to Work model, which is based on our organization culture research. We define a great workplace from an employee's perspective as one in which they trust the people they work for, they have pride in what they do, and they enjoy the people they work with. So the focus is really on relationships, 3 key relationships: with management, your colleagues, and your job. We measure these 3 relationships using what we call a trust index survey and utilizing the 5 dimensions, which you can see in the graphic and on the right. At the top of the graphic, you can see the dimensions of credibility, fairness, and respect. These focus on an employee's relationship with management. On the lower left is the dimension of camaraderie, which focuses on the relationship with colleagues. And on the lower right, the dimension of pride that focuses on your relationship with your job, the work you do, the team you work with, and the organization you're a part of. So each of these dimensions are key components of great workplaces, and together enable building a foundation of trust. The foundation of trust and relationships builds resilience for individuals, teams, and organizations. And it can be critical in responding to crises like we are experiencing with COVID. So in my comments, I want to share examples of some healthy practices of great workplaces. Now I want to note that these examples are focused on a particular group. That is, employees who are still employed with organizations that continue to be viable. I want to acknowledge the significant needs of those employers who needed to close their businesses and employees who lost their jobs temporarily or permanently. Theirs is a very challenging situation that I want to recognize as well. Next slide. With the vast and sudden disruption that was caused in the country and region-wide responses to COVID, we've observed that those organizations with strong company cultures pre-COVID were best equipped to respond quickly and effectively. They drew on established workplace values, leadership practices, and a focus on their employees. In great workplaces, managers and colleagues demonstrate care for the individual as a person, not just an employee. They create an environment of psychological safety, including confidence in management delivering on its commitments, the organization supporting employee needs, and building supportive relationships. Great workplaces promote wellness using a holistic approach, including a focus on work-life balance. They create structured and informal opportunities to have fun, to laugh, and connect with others. Pre-COVID, most work was done from an office or the workplace. Communications were mostly in person, and people had their routines, including their commutes, favorite lunch places, and personalized workspaces. In short, great places were anchored on trust and relationships that enabled individual and organization resilience. Next slide. One before. Previous one. Thank you. Oh, one forward. Other direction. And one more. Thank you. So with COVID, it highlighted that company culture isn't tied to the 4 walls of a building. It's a set of experiences that people have every day that create a great workplace. With COVID, we saw a dramatic and sudden shift in the workplace. Many employees were suddenly working from home. Communications went virtual. Some suddenly found themselves alone, while others were very much together with parents or children or both, 24/7. Many employees experienced the positives of working from home. For example, time saved and stress reduced by not having a commute. But there were also new stressors, including setting boundaries for work and home and managing Zoom meeting fatigue. But amid the fear and uncertainty, employees were also energized and organizations mobilized to meet the immediate threats. In great workplaces, we saw them build on and tap into their pre-COVID values and strengths. They prioritized employee health and that of their families, including things like providing how-to guides for working from home, providing access to mental health services, and family care packages. They recognized that employee needs differed widely, from those without personal computers or internet access to those now caring for elderly parents and school-aged children. They also understood the need for regular and coordinated communication, from senior leaders to managers to team members, and that communication focused not only on work, but also the personal experience. So leaders acknowledged realities, they provided reassurance and reinforced patience, and also shared vulnerability, including stories of their own challenges. Teams coordinated their work, but they also figured out how to have fun, from virtual lunches and happy hours to sharing pictures of home workspaces and vacation places they look forward to going sometime in the future. Unexpectedly, many organizations reported initial bumps in productivity for the first few months of work from home, as employees rallied and responded to the unique circumstances and the new ways of working. Which brings us to the challenge now. What happens next as the novelty of COVID-forced work from home subsides and transitions begin to the next normal or the new normal? Next slide. So the focus for great workplaces in the next normal is to figure out how to live and reinforce their workplace cultures virtually. They are focused on the forward space rather than looking backward. They continue to emphasize employee safety, both physical and psychological. They recognize that they will be managing hybrid workplaces where some employees return to work in the office while others remain working from home. They're focusing on evolving their systems and practices to ensure that those working virtually continue to feel connected and engaged. Great workplaces are continuing to practice regular two-way communication, providing timely information in a variety of modes, asking for employees' input, and then responding situationally as needed. They're building on their COVID experiences and learnings to be prepared for responses to a variety of scenarios. They're looking to stay flexible and adaptable in the face of an uncertain future. Recent Great Place to Work survey data indicates there are 5 things that employees really want from their organizations at this time. First, trustworthy leaders. Second, leaders who trust them to do their best. Third, human connection and shared awareness that we are in this together. Fourth, multifaceted wellness for the self, for my family, for my community. And finally, treating all people with respect and fairness. In sum, great workplaces continue to evolve as their environments and the needs of their employees change. A big part of their success is enabled by their pre-COVID foundation, which is built on strong caring relationships and trust. In closing, on behalf of all of us at Great Place to Work, we appreciate your commitment to building healthier workplaces, and we hope you have a great session. So now I'd like to turn it over to Julian Raymond, who will be facilitating the first panel discussion. Julian?
Thank you very much, Tyler. So guys, thank you very much for having me. My name is Julian. I'm the co-founder and CEO of Awaken Mind, and I'll be moderating this first panel today. So just at the very beginning of that presentation, we've all been sent a poll which asked, how much do you think migraines and chronic pain in general, or specifically migraine, sorry, cost the Singaporean economy? So the actual answer is 1 billion Singaporean dollars. So chronic pain, which includes but is not limited to migraines, have a direct impact on health and productivity that can sometimes be completely drastic. Deteriorated health, poor work performance, a lessened ability to focus, lost work days due to absenteeism, and so on, are just some of the challenges that chronic pain patients are facing every single day. So to talk about that important topic, we've invited leading experts to present and discuss the economic burden, the top issues, and the challenges that come with migraine and mental health in general. So our 4 speakers are Dr. Eric Finkelstein, who's professor of Health Services and Systems Research Program at the Duke and US Medical School of Singapore. We have Associate Professor Dr. Ivy Cheng, who's Deputy Dean of Health and Wellbeing Research Cluster at the University of Malaya in Malaysia. I'm really sorry about the background noise there. We have Associate Professor Dr. Wan Alia, neurologist and Associate Professor at the Faculty of Medicine and Health Sciences at the University of Putra in Malaysia. And we have Dr. Rosalina Picard, who's working at the Philippine Neurological Association as their president. So thank you very much, guys, for joining us today. Without further ado, I'm going to let Dr. Finkelstein start and present the economic burden of migraine in Singapore.
Great, thanks so much for the introduction. Can you guys hear me okay? Yes?
Yes, all right.
Okay, so I think my video needs to be started from the host. Okay, so great. So welcome everybody. So what I want to do is talk just in the next 15 or 20 minutes about a study that we conducted in Singapore that aimed to quantify the economic burden of migraine. Now, unfortunately, the poll has given away the answer, so there's not going to be much suspense, but at least you can see how we did it. So let me flip to the next slide. Next slide, please. Okay, so this is a summary of a paper that we published in Cephalalgia Reports, a peer-reviewed journal, and basically the study itself focused on two different types of migraine. Now, migraine, as many of you may know, and I suspect a few of you have suffered from, is really a debilitating condition, neurological condition that's a pretty intense headache, to put it bluntly. And it's actually very prevalent in the world, and certainly in Singapore. And the prevalence of migraine has actually been increasing over time. And the reality is that although there are some effective treatments, most people don't get them. And so as a result, there's a lot of what I would call sort of medical odysseys, where people are interacting with the health system, trying to find A, what's wrong with them, or B, something that can help alleviate the pain. But in fact, even more prevalent are people who just do their best, and they go to work when they shouldn't, or when they're not particularly productive, and we call that presenteeism. Or they end up taking leave from work, either using vacation days, unpaid days, or sick leave, because they're just not able to be functional. Next slide, please. Now, we aimed in this particular study to try to quantify how much migraines cost the health system in Singapore as a way to draw attention to this debilitating condition. Now, hopefully you guys can hear me. I just adjusted my mic. I saw a note that my voice was soft. So what we did was we did a cross-sectional web survey of people in Singapore, and we identified a sample who had evidence of migraine, and then we quantified their health-seeking behaviors, their increased medical expenditures, as well as how much time they lost from work, either due to absenteeism or because they came to work and were less productive than they otherwise might have been. Our sample was really adults who were in the workforce, 21 years or older, citizens or PRs, and that were either full-time or full-time self-employed workers, and who had evidence of migraine based on the international criteria. Now, the way we did it, and I'll talk about this in a second, is we used this sample to understand the per capita or per person cost for migraine sufferers. And then we applied those per person costs to data on prevalence from another source to get the total cost. And you'll see that in a second. Next slide, please. So I won't go into the details, but basically there are really three types of migraine sufferers. Those who what we would call lower end episodic migraine sufferers, who have migraines but not quite as severe, less than 3 migraine monthly days. Then there's a group which we call upper end episodic migraine sufferers, 4 to 14 days. There's actually a third group who have chronic migraines who really debilitating, but that group is fairly small and we couldn't find them in a web panel. And so we really focused on the other two groups, which is the vast majority of migraine sufferers. And as I said, we used our web survey to get the per capita costs, and then we multiplied that by prevalence to get the total costs. Okay, next slide, please. So we managed within our survey to get 606 respondents who were migraine sufferers, mostly Chinese, of course, because it's Singapore, mostly married because that tends to be who does web panels, and fairly well educated. Now, of our 606 respondents, consistent with migraine, 81% were LEM, or the lower episodic migraine sufferers, and the remainder were the upper sufferers, the more severe cases. Next slide, please. Now, you heard the punchline about the total cost being $1 billion, but let me just tell you about the unit cost. It turns out that if you look at the cost for the lower episodic migraine sufferers, it's about $5,000 per year. And for the UEM group, it's an amazingly high $15,000 per year. Now, if you look at the pie charts, one thing that you see immediately is that the vast majority of the costs are due to lost productive time. In fact, for the LEM group, it's really more to do with absenteeism, although there's a significant presenteeism component of this. But for that more severe group, presenteeism tends to dominate, in part because these guys kind of tear through all their sick leave and then end up going to work because they have no other choice, but they're not particularly productive. Now, this is not to say that the medical cost piece of this is not large. It is, but so is the presenteeism and absenteeism cost. Okay, next slide, please. So just to summarize, you know, the costs are $5,000 per capita for the LEM group, almost $15,000 for the UEM group. And I think what employers should take notice of is that 80% of these costs are really around absenteeism and presenteeism. And I think that's really worth keeping in mind. Now, another point that's worth mentioning, as I suggested earlier, is that for the healthcare costs, the biggest costs are medical tests. And these are the sorts of tests that I sort of feel are consistent with the idea of this medical adventures, where you're trying to figure out what's wrong with people and hopefully finding a solution, but it's not necessarily making these guys feel any better because you're not necessarily bringing effective treatments, despite the fact that they do exist. Next slide, please. Okay, so let me switch gears and just talk a little bit about prevalence. Now, if you download the paper, which is freely available online, you'll see how we went about this. But in short, the prevalence of migraine among full-time employees in Singapore was estimated to be about 8%, 6% of the LEM group, and 2% of the upper extremity group. There's about another 1% who are really the chronic cases who we ignored, but in our focus, you're looking at about 150,000 migraine sufferers in Singapore, which is not trivial. And so that's why you end up with this $1 billion figure. So next slide, please. Now, I know this slide is a bit hard to follow, but basically it's fairly simple. If you look, we stratified by age and by gender, because the unit costs differed across these groups. But if you look at the employed residents in Singapore, the first couple columns just tell us how many of these people exist. And then the next couple columns tell us what percentage of these individuals suffer from migraine. So if you multiply these numbers together, you get the number of migraine sufferers within each of these age, gender, / type of migraine sufferers. And then we multiplied those number of individuals times the corresponding unit costs to get total costs. And so on the right-hand side of the page, you can see what the total costs are for each cell. And then if you add up all the numbers, you get, you know, almost $600 million in costs for the LEM group, another $438 million for the UEM group. And adding those two groups together, you see we come up with the magic number of $1 billion, which maybe a few of you guessed right. Next slide. So I think one final point to keep in mind is that these are certainly significant costs and therefore worthy of trying to address, I think, from employers, insurers, and government's perspective. Now, it turns out that if you look at the prevalence of migraine, you have 20% of individuals in the upper extremity group who amount to about 42% of the costs. So certainly disproportionate in terms of burden, and therefore the remaining 80% account for the 58% of costs. So, when I think about burden, I think about burden in many domains, one of which is prevalence, and another one is economic costs, right? And so what we see is that although one group is greater in prevalence, the other group is greater in economic costs. Now, there are other measures of burden like disability adjusted life years or life years lost or QALYs, but I think prevalence and economic burden are certainly two that policymakers do and should pay attention to. And so that was our focus for this manuscript. Next slide, please. So really just to wrap up, migraine is a significant problem among the full-time employed population in Singapore and certainly should be addressed. And I think not so much on the slide, but the truth is that there are cost-effective treatments that unfortunately are not going to people who can benefit from them. So I think the obvious next step from these types of studies is to say, okay, we recognize that migraines are a health problem. We now know it's an economic problem. What can we do to try to address that problem, and recognizing that that could be good for the individual as well as good for employers and economic output as well. So let me stop there, and hopefully I'll have a chance to take some questions. Thank you very much.
Thank you very much, Dr. Finkelstein. So let's keep this going, and I'm going to introduce now Associate Professor Dr. Ivy Cheng, Deputy Dean of Health and Wellbeing Research Cluster at the University of Malaya in Malaysia. Dr. Cheng will present the impact of migraine on workplace productivity and monetary loss.
Thank you, Julian. And a very good afternoon to all audience out there. Maybe I'll wait for my slides. Yeah, again, my name is Ivy Chung. I'm from University of Malaya, Malaysia. So next slide, please. So I'm very privileged to represent my team today to share with you our recent work on the migraine and workplace productivity. This work has just been published recently in the Journal of Headache and Pain. So I welcome everyone who are interested to look at this article. If you, it's free available for download online. Next slide, please. So this study is the result of a collaboration between University of Malaya and also our corporate partner, Novartis Corporation. So as you can see from the slides, our whole goal here is to determine the impact of migraine on work productivity and activity impairment, the cost loss attributed to absenteeism and presenteeism, and we have covered some part of this in the previous section, as well as treatment-seeking behavior among our study participants. We designed our study around using internet-based survey. We focus on 2 local banks, so it's in the financial industry in between April to July 2019. And our criteria of participants in this study is that we welcome permanent employees, at least with 6 months employability in the bank, with age between 18 to 60 years old. And so we have recruited from this study about 1,268 participants. And just a little bit on these participants, about 70% of them are females, and they're within the range of 30 to 40 years of age. Next slide, please. Can I have a next slide, please? Thank you. So, so from our 1,268 participants, we realized that almost half of them, that's close to 598 numbers, and 49.3%, they were diagnosed with migraine. And how we diagnose them is based on the ID migraine test, which is a valid and reliable screening test we use in the clinic. So when we focus on this migraine sufferers, we further categorize them according to the disability. So we use this migraine-related disability scores, MIDAS scores, and we realize that you can see from the graph that almost half of them likely, they have little or no disability, although they are being diagnosed as having migraine. So this is MIDAS grade 1. But if you look through the rest of the graph, you realize that a third of them, they are in grade 3 and grade 4. So what this means? They means they are showing moderate or to severe kind of disability because of migraine. So if you focus on the graph on the right, the red graphs, you realize that only 10% of them experience an average of 1 to 5 times of migraine attack in a week. So I convert that into week numbers. 1 to 5 times of migraine attack per week. So if you're lucky, you get once a week. If you're not lucky, most likely most of the whole week you're getting migraines. So I think as our group still think this is a worrying number, because some of these migraines may not be predictable. No, we don't know when they'll come. So okay, next slide, please. Right. So, okay, that was from the subject point of view, but from the employer perspective. So what does all this mean? So we were also calculating the absenteeism and presenteeism based on the disease severity. So as described earlier, absenteeism basically is just non-presence of the employee at the workplace. So this could be due to migraine. It could be due to scheduled vacations, or just you want to rest at home. So you can see from the graph on the left, you appreciate that there was a significant gradual increment in absenteeism as the MIDAS score increases. So the higher the MIDAS score, the greater the percent work time missed. So that's absenteeism. If you focus on the graph on the right, then you will realize the presenteeism also sharing the same trend. And from our sampling, we realized that our participants, despite having migraine, they chose to go to work. So I think this is Asian culture. So so by presenteeism, we are measuring the percent productivity loss at work, and you can see here, even grade 2 MIDAS score can result up to 42.3% productivity loss. So not to mention, if you're in grade 3 or grade 4 MIDAS score, which is quite severe in terms of the severity of the disabilities, these subjects, at best, they are working 50%, functioning 50% of their working time. So they may be present at work, but 50% they are not really there and can't really work. So next slide, please. Right, so when we analyze everything together, here I want to show is that if you compare absenteeism versus presenteeism, which means if they are actually actively applying for medical leave and they stay at home, which means absenteeism, or they having migraine and they go to work, this presenteeism, you will see there's a huge difference in terms of productivity loss due to presenteeism. It's about 20 times more than you compare to absenteeism. So when we also calculate whether migraine will have an impact on the activity impairment. So activity impairment, which means a specific activity in the job, could be doing some desktop jobs, or if those are at the counter, the bank counter, their customer service job, activity per se, is about 38.4% productivity loss. And if you work at overall work impairment, so when we ask them to evaluate how does this migraine affect the overall day at work, it's also about 40%. So 40% is not trivial, I think. In the next slide, please. Now, if we were to convert those information into monetary values, this is where we try to also do similar thing like how the NUS is doing. Then you will realize that we found a steep increase in monetary loss for moderate to severe disability. It makes a lot of sense here. You can't focus and you can't do work. So if you look at the graph on the left, this is for the absenteeism, right? If you're in grade 4, MIDAS, then it's about 3 times more. And we are losing about average of 4,900 Malaysian ringgit. So this is about roughly about a little bit under USD $1,000 per employee, per capita per year. So this is if the employee decided to take leave and rest at home. Now, if you see the graph on the right, this is for the presenteeism. Then the numbers is totally in the different range. We realize that now from the if you are grade 4 sufferers, then we are talking about 12,400 Malaysian ringgit per capita per year. The way we calculated this also almost the same like what Dr. Fingerstein has described. We just take the average of the salary range and then multiply with the numbers of the sufferers. So, and you can see there's a dip. So the more, I think the message is clear. You don't have to understand how much the value. If you're in the most severe grade of MIDAS or most severe disability of migraine, it costs more to the employers. And so now this is only monetary. I don't want to just be seen talking about monetary. I think you also shouldn't forget that the tremendous burden on the physical, the emotional, as well as the quality of life of the employees while suffering from migraine at work. Next slide, please. So then we want to look into their treatment-seeking behavior. So we realized it's really shocking to us that only half of them, those with migraine, they have been seen and diagnosed by doctor. So which means because our questionnaires, we ask them questions about the symptoms, are they sensitive to light, having nausea, or that kind of the way they feel. But only half of them actually think that they have been seen a doctor, so being diagnosed. But the other half, they are not getting any medications or proper clinical treatment. So this is really shocking to us, and I think we have to do something about it. And from the graph, if you just focus on the MIDAS grade 4, right? So only 28% of only half of those with grade 4 MIDAS, only half of them actually going through a proper clinical consultation and being they're taking the prescribed medication. So despite in grade 4, only half of them actually being treated properly. So I think at individual level, we feel that it is important to take note that after also through the survey, we also realized that migraine, the individual should think that migraine is not just a chronic condition. It really requires proper intervention, proper management, because it can get worsen over the course of the disease. And at organizational level, I think we feel that migraine should be really considered a silent productivity killer, just like toothache. Just having something lurking behind, you can't really focus and you can do work. So I think the prevalence is huge in our study, and the cost is there. And we feel that especially I think we have to take note of this issue, because in Asian culture, when we talk to we approach the participants, we feel that they are not sufficiently aware what they're suffering from, and whether they should go to doctors and get proper treatment. So this could be addressed by the employer or by the policies makers here. So we hope that through this event, we can promote more awareness about the impact of migraine, the burden, both to the individual and organization. I think that was my last slide.
Brilliant. Thank you so much, Dr. Cheng, for
your
insights. So if anyone has a question to one of our panelists, by the way, you feel free to just write it down and send it out via either the Q&A functionality or the chat. We'll try and address them all at the end of the presentations. So our next speaker is going to be Associate Professor Dr. Wan Alia, neurologist and associate professor at the Faculty of Medicine and Health Sciences of the University of Putra in Malaysia. Dr. Alia is going to present migraine and mental stressors in the workplace.
Thank you, Julian. I appreciate the kind introduction. So hi everyone, is my audio okay? So I'm Dr. Wan Alia. I'm a consultant neurologist with a special interest in headache disorders and medicine. And it's very great to be speaking with all of you as far as from Philippines and Singapore. So greetings from Malaysia. So I hope that everyone will enjoy our meaningful discussions about migraine and mental health today. And let me just, start my screen. All right, so how many of you had experienced a very terrible migraine? Maybe if you can put a thumbs up ration, if it's possible. Okay, thanks. Now imagine if you wake up early in the morning with a very bad, terrible headaches, and you're very sick at your stomach, and you just couldn't do anything with it. How would that feel with that kind of headaches? So what is migraine really, and how does neurologists or doctors diagnose that your headache is migraine? So basically, to diagnose migraine, we have 3 important symptoms. First is the headache severity is very severe. It's a horrible, terrible, bad headache that makes you just to stop any activities that you're doing. You just need to have a rest and lie down. And if you move around, then the headache will be worsened. It can be one-sided headache or both sides of your headaches. Secondly, in terms of the symptoms, besides the headache, you can have nausea where you're feeling sick to your stomach. either you'll be vomiting or maybe just feeling sick. And then you have light and sound sensitivity, whereby you notice that bright lights will make the headache worse, or loud noise will make the headache becomes more severe. So this is called light and sound sensitivity. And then thirdly, in terms of the durations, it's quite prolonged headaches. It lasted about at least 4 hours, and it may last up to 3 days. And it can be recurrent, especially in chronic migraine sufferers, where some of the patients may have daily episodes of headache. So if you have these 3 symptoms of headache, then clinically, then we diagnose this as migraine disorders, migraine headaches. We go to the next slide, please. Now we understand what are the symptoms of migraine as I have outlined with the 3 important symptoms. But what causes this migraine to occur in some individuals, and some individuals does not have these terrible headaches. So the underlying biological cause of these migraine disorders is due to hypersensitivity of our neural networks. So it's inherited, it's a genetically induced hypersensitivity of the TVS, as we term it, short form for trigeminal-vascular system. If there's any certain triggers, for example, environmental causes such as stress, or change in barometric pressure, which is a sudden change in the weather, where you can have a sudden storm coming and suddenly you can have the headache. So that is also triggers, or even hot weather, you know, like Asian weather, we've got very hot temperature, that is also can become triggers. Or you can have metabolism causes such as certain diet like alcohol or coffee that could trigger the TVS system, lack of sleep, as well as lack of exercises. Hormones play important role in the trigger as well, such as menstrual cycle, and even drugs such as overuse of painkillers may be triggers of migraine. So once these all triggers occur, the TVS will be stimulated, and it causes activation, either locally or distal activation of the neural pathway, which produce protein or neuroinflammation, and this is the culprit of the headache itself, by the neuroinflammation. One of the important protein is called CGRP protein, calcitonin gene-related peptide proteins. Okay. This diagram is a simple illustration of what I have explained of the pathophysiology. So in a person with migraine, you can see the brain structures are a bit different from person without migraine. So with the hypersensitivity of the TVS network, they are very prone to be activated by all the triggers mentioned. Next slide, please. Okay, so now we have understand what causes migraine in certain individuals. And now we want to look what are the association with migraine with some of the important mental health issues. So one of the common things that's very important in the working place is, of course, stress. So there's a very important study done about 2 years ago by Kroll, LS, and his colleagues. So Dr. Kroll found out from his study in 2017 that the person with migraines have about 3 times higher prevalence of having stress as compared to person without migraine. So you can see that in this diagram, this is the frequencies of stress in the persons without migraine and with migraine. So in the person with the high stress levels, it is more common in the migraine patient itself, so about 39%, and 13% of the control, which is without migraine, they have a lesser stress. Next slide. All right, so how does migraine and stress impacted the country and the society in a whole? So we can see that migraine caused a big financial burden to the United States. In a year, it cost 40 billion USD per year to the United States. And Dr. Finkelstein and Prof. Ivy Chung had already illustrated the big economic burden to Singapore and Malaysia as part of the Asian country as well. So in terms of prevalence, I think one of the causative factors to this higher economic burden is due to the common, migraine is quite common. So 1 in 7 people, we have migraines, and the prevalent peaks is in the 25 to 55 years old, which is in the productive working age force. So that is the big hit in the productivity. And the second is the second most disabling disease in this age group. And of course, if the worker can have migraine, it can significantly impact their productivity at work, has been illustrated before. Next slide, please. All right, so we have understood what is the problem now in the society and how bad migraine could be. So as an employer, how can we minimize this impact and help employees with migraine? So first, employers have to understand that migraine is real and it's terrible. Okay, and migraine can be controlled easily by avoiding the triggers of it. So the working environment, which plays a very important role in the worker's life. So it may be a source of their migraine triggers. Thus, we need to identify what are the triggers in the working place and perhaps change it if it's possible. So first and foremost, in terms of the lighting, so bright lights such as LED lighting or fluorescent lightings may cause maybe a trigger of the migraine. So try to change it into a more natural lightings. And then maybe provide glare protectors for the computer screen so that we can reduce the glare, which can be a trigger itself. And provide noise cancelling headphones or reduce the loud noise in the working environments. And encourage regular breaks at work and encourage for them to do some stretching and physical activities as much as possible, especially in a prolonged working hours. And the most important thing is to provide a dark, quiet resting area for the workers to have a rest and maybe to have a quick nap if they have their migraine attacks. And with easy accessibility to drinking water, ice packs, and maybe basic painkillers such as paracetamol so that they can abort their migraine attacks as soon as possible. A very important concept is what we call workplace migraine intervention program, which is run by the occupational health doctors. This has a major role in trying to identify and treat the migraine in the working environment. And I think this will be discussed in detail in the next sessions by other panelists. Next slide, please. All right, so we have to understand how stress play a big role in the migraine, in a person with migraine. So it's like a vicious cycle. It could trigger your migraine and it's also associated with high stress in migraineurs. So as an employer, what are the proactive role that the employers can play to reduce the stress in the working environments? So I have illustrated in this simplified diagram few important things that we need to highlight for better stress management. First is meditation, encourage deep breathing exercise, yoga, or maybe in Muslim, we encourage them to do salat and ibadah. Secondly, we get them to exercise, get them move. Thirdly, we get them to sleep better, to eat better, as well as to connect socially, join a club, as well as to prioritize and do a to-do list task, which is to reduce the mental burden, mental overloads, and hence it will reduce the stress. So besides these important things, another thing that I would like to highlight is actually for the employers to actually create a work flexibility where the employer should allow them to take time off work or even allow work from home if they have severe attacks of migraines. And also as well as to allow them to work for a shorter period of time or to reduce the workload or the task for them, especially when you have a severe migraine attack, because we know that each attack can last about 3 days long. So the employers have to be more understanding of the employee situations, right? And they have to ensure that workers take enough time off to rest after each episode or reduce the workload, as I have discussed. Next slide, please. Okay, so I have arrived at the end of my session. So just 3 take-home message to summarize. So migraine is a common inherited pain disorder, so to say, which cause hypersensitivities of the neural pathway, causing severe, terrible headaches. And migraine is related to stress as an important key mental health issues, and it causes a big burden to the society. So it causes big bucks to the societies. So the employers has a major role to play, proactive role to help the employees with migraine to identify what the triggers of migraine in the workplace and how can we minimize the triggers there. with that, I end my talk. Thank you so much.
Thank you very much, Dr. Alia. Our last panelist is going to be Dr. Rosalina Picard, who is the president of the Philippine Neurological Association. Dr. Picard is going to present new ways of seeking treatment.
Good afternoon. May I have my first slide, please? I was tasked with talking about new ways of seeking treatment, especially in the setting of COVID-19. And I would like to talk about the experience, in particular in the Philippines. Next slide, please. As you know, the Philippines was actually put on extended quarantine starting on the 16th of March. You can see that the Philippines is an archipelago. So that means that we are really separated by geographical barriers. However, there are really areas with increased density of the population. And that is mostly those areas with high risk for contamination and spread of the infection. Next slide, please. So the enhanced community quarantine is actually considered the longest and the strictest in the world. And it started in March 16 and is still ongoing as of the present day in various forms. They have laxed up a little bit in terms of the quarantine regulations. However, there is still a significant reduction in terms of the capacity for patients and physicians to seek help, as well as for business activity to continue. It is currently affecting 58 million Filipinos in terms of differences in terms of access to healthcare, in terms of access to places of business, in terms of access to the workplace. Next slide, please. So when we started having the quarantine, there was actually, the Philippines actually went into a rude awakening. In particular, the Philippine Neurological Association. There were significant realities of the ECQ. Patients had limited access to care. There was a lack of infrastructure for telemedicine. That means telemedicine was unheard of in the Philippines. We used to do, and we are still very used to doing medical care in its more usual and conservative form. That means you visit the doctor in the hospital and you get a written prescription. The other problem is the absence of a national health database in which patients are actually enrolled in a national database wherein physicians can actually access patients' medical records. And unfortunately, that is still very badly lacking in the Philippines. The other problem is patients had fear of contacting the disease. So they were not going to the hospitals. They were staying away from medical facilities, even though they needed emergent care. And there was also limited access to medications, mostly because prescriptions were required for certain medications, especially for those medications requiring neurologic care, such as benzodiazepines, phenobarbital, which is still the most common anti-epileptic drug that is used in the Philippines, require a different kind of special license for you to be able to access these medications. So a big problem was access to medications and access to medical care. On the other hand, physicians had limited access to their patients, mostly because we were so used to face-to-face clinics that patients were refusing to go to the hospitals. And the other problem is that because of the ECQ, transportation was impossible. There was no mass public transportation, and therefore patients could not really access medical care. Next slide, please. So what we needed to do in the association and in terms of our efforts is really to find solutions. And we ended up working together in terms of not within our association alone, but also with other society, medical societies and professional societies in terms of trying to fill these very important gaps in medical care. Next slide, please. So the first thing that we needed to do is the very next day is actually to write to government. One thing that you need to understand about the Philippine government is that you get what you ask for. That means that you really need to require government to respond to your problems. It is a bit, they are a bit reactionary, and that is actually unfortunate. We would wish that they'll become more proactive so that they can actually anticipate problems instead of reacting to them. Be that as it may, they actually responded very quickly to our appeal, in which we would allow electronic prescriptions to be honored by drugstores. So therefore, our patients who had chronic conditions, not necessarily confined to migraines, such as epilepsy, Alzheimer's, stroke patients, had continued access to their medications. That was the first thing that we needed to do. We needed to make sure that patients had access to medications, and we needed to do that by providing a means by which patients can get the prescriptions from their doctors, either electronically or online. And these prescriptions were actually honored in the drugstores. Next slide, please. The other problem is provide the means by which patients and doctors can stay connected. Because of the lack of an infrastructure by which this can occur, we needed to think out of the box. Staying connected electronically or staying connected through social media is nothing new to the Philippines and to the Filipinos. In fact, next slide, please. We're actually very good at staying connected. The Filipinos rank first in terms of the use of the internet worldwide. And this is based actually on information, but it was January 2019. The Philippines actually tops the use of internet worldwide. We actually average 10 hours per day spending our time in the internet. The other thing is that we're also very, very frequent social media users. We use social media on average of 4 hours per day, twice more than the US. The white line in the graph actually represents the worldwide averages. And you can see that the Philippines is actually on the left side of the graph. That means we top it. So the Filipinos are very connected. They're very connected. They're very internet savvy. And that means that they use social media frequently. Knowing that the Filipinos are in the majority are actually connected, then that was actually the opportunity that we needed so that we can actually remain connected with our patients. The unfortunate thing is, next slide, please. Even though we are connected, the speed is one of the worst in the world. So actually we're in the bottom 5 on the right side of the graph. We're in the average internet connection speed is around 15 Mbps. And that is on a good day. And so you can see that even though Filipinos have very, very slow internet speeds, they still connect to the internet and they still use their social media vigorously. And therefore, looking at this statistic and this fact, the Philippine Neurological Association therefore embarked on a way or a more effective way of connecting with our patients. Next slide. The first thing we needed to do was to create a telehealth and telemedicine task force. And the main purpose of this group of individuals is actually to devise a way by which a connection or a relationship can exist between patients and physicians. Either they are established relationships, that means they're old patients, or to reach out to new patients. The important thing is to get them connected. And the other important thing is to protect the relationship. And that means to protect our physicians and also to protect our patients. So we needed to create guidelines by which our physicians can be guided as to how to properly connect with their patients, how to conduct neurologic examinations online, which is actually very important and very difficult. And therefore, we crafted the telemedicine guidelines. Next slide, please. So we provided an infrastructure for teleneurology. So the Philippine Neurological Association actually published guidelines for telemedicine consultation during the COVID-19 pandemic. And as you can see, the publication rates around April. So we were working double time. Within 2 weeks of the ECQ, we already provided an infrastructure for teleneurology, and we cascaded these guidelines in terms of how our members and how our fellows can actually start doing telemedicine consultations, doing online clinics, and trying to stay away from face-to-face or traditional consultations so that actually the physicians and the patients can remain connected. Next slide. And we made it in such a way in terms of simplifying these guidelines for the older generation, of which I am an honorary and very proud member. Not everybody is tech savvy, and of course we had a significant amount of rejection, a significant amount of trepidation in terms of going around these steps. But when we try to simplify this guidelines in terms of looking at infographics that are actually very easily understood, then actually it took a little bit of time, but eventually, of course, even those who are of the older generation eventually picked up on how we should do this correctly. And of course, the things that we needed to emphasize was the importance for getting consent for the consultation. And we needed to emphasize that patients need to understand that if they need emergent care, they should go to the hospital even though they are afraid. And that this teleconsultation was mostly for non-emergent cases because we needed to prevent contamination of our patients as well. So technical tips were actually also emphasized in terms of looking at the means by which they can actually connect with patients. And what we found out is that actually using social media seems to be the most effective way by which a common platform exists for both physicians and patients. And you can see that if you are a Facebook member in the Philippines, you can actually see that a lot of physicians have Facebook clinic accounts, and by which patients can reach out to their doctors, can set appointments, and the consultations are even done during Facebook, using Facebook Messenger or other forms of social media. Next slide, please. We also needed to give guidance in terms of what we needed to look at, and the importance of providing neurological care during the quarantine. And we also have guidelines for patients and caregivers in terms of what are the basic necessities. So we needed to always emphasize the limitations of telemedicine and in terms of what potential benefits patients can have. And therefore, the guidelines were actually passed through medical, legal, and ethical reviewers to make sure that the guidelines are ethical, and also to make sure that the guidelines are compliant with existing legislation. Next slide. So the other thing that we needed to do after we connected with our patients is empowering the health providers. And from the earlier discussions, you can see that the biggest shift is really from face-to-face encounters towards virtual conferences. And this is actually the first things that we actually needed to be comfortable with. And through a series of webinars, we actually reached out to our membership in terms of what COVID-19 is and in terms of its impact in terms of the nervous system. We talked about teleneurology and emphasizing again the guidelines, as well as how to do a neurologic examination through the use of telemedicine. We also started talking about how do you restart a neurology clinic after the ECQ, when the ECQ was actually relaxed a bit in terms of coming out with hybrid clinics by which you can actually do face-to-face consultations with utmost care to maintain physician safety as well as patient safety. We also talked about how do we do training, how do we teach in the new normal, because a big part of the problem is in terms of how do we continue residency training and how do we continue academic activities in the settings of virtual learning. Next slide, please. The next step that we needed to do was to empower the patients as well. So aside from empowering physicians, we needed to reach out to patients. We needed to provide them with the necessary information that can help them to understand their own illnesses, to help them manage their own diseases in a way. And this is how we accomplished it. Next slide, please. In our website, you can actually see what we call a neurology info line. And what we did is we talked about the more common groups of neurologic diseases: dementia, epilepsy, headache, movement disorders, neuropathies, and sleep disorders. And we talked about frequently asked questions. What are the usual questions, especially in the light of COVID-19? Because there were a lot of misinformation. There was so much information during that time. And we needed to help our patients in terms of to tease through what is accurate and what is actually real. So it actually was a means by which we provided a platform by which patients can access information about common neurological diseases. And also I provided a platform by which patients can seek neurological help online. So as you can see that the telemedicine telemedicine icon is actually on the website. And there you can actually look at the lists of neurologists who are willing to do telemedicine based on geographical area in terms of where you are, so that after the pandemic, you can actually continue to see these doctors or these physicians. Or if you are looking for your physician and you want to reconnect, then that's actually a way by which we make this possible. The other thing that we needed to talk about was mental health awareness, which was very important, and I think still a very important problem in the light of the realities and the altered realities imposed by COVID-19. Mental health awareness primarily focused on how to ground yourself in terms of this very uncertain situation and in terms of coping in terms of stress, because indirectly stress will also affect headaches, for example. Next slide. So we provided educational materials that are easily understood, which are evidence-based and easily disseminated. So we crafted infographics, and infographics were not made by commercial entities. These were made by our members. So we actually utilized all of our capacities. We did everything on our own in terms of coming out with these guidelines and with this small snippets of information. So you can see that you have frequently asked questions about what are common headaches, what are the triggers, when should I worry about my headaches? That means when they need urgent care, and what is the management of common headaches. And we also added in something that is pertinent to COVID-19. We also did a lot of collaborative work with a lot of other professional societies, so we can come up with common communications and actually common messages. And these infographics are very easily transmitted through Viber. So we actually developed a communications network by which all of our members are connected by Viber, and we actually disseminate information very efficiently through this network. And we actually asked our fellows and our members to disseminate this to our own minimum spheres of influence, meaning our own patient groups, so that whenever they have these questions, then you can actually easily answer them by providing them with this simple infographic. Next slide, please. I just want to take a bit of time in terms of talking about COVID-19 and mental health. The Philippine Neurological Association, in association with the Philippine Psychiatric Association, is actually very intertwined, or shall we say very involved in mental health, mostly because of the National Mental Health Law. The COVID-19 is a very unique stressor, and definitely something that poses a significant threat to mental health in the Philippines. And even through these moments, we're actually going through several educational activities by which we focus on mental health. And we also talk about mental health in terms of legislation and in terms of education and in terms of even the medical curriculum. So mental health is a continuing challenge, and we are next slide. Hello? All right. So aside from mental health issues and aside from information with coming from the society itself, in terms of coming out with webinars that were actually very helpful in of migraine in the workplace, for employee mental health in the face of COVID-19 in terms of how they cope with it, and in terms of what would be the best ways by which they can cope, and as well as the impact of migraine and its management in the workplace in the Philippines. So aside from this webinars and educational activities, the Philippine Neurological Association, we are not unique in this. A lot of the professional societies in the Philippines have actually for the first time gone into virtual medical conventions and conferences that we have opened to everyone. That means we have waived registration fees, and we have opened this scientific activities and scientific fora for all physicians, so that they can be empowered, and so that knowledge is not the monopoly of a few. The other important thing is that the Philippine Neurological Association, in association with the Philippine Headache Society, just actually embarked on a series of webinars for the whole month of September in commemoration of the Migraine Awareness Week. And we were going to be talking about, we actually had the first one last Saturday, sorry. And we talked about migraine and migraine pathophysiology, and we're going to be talking about all the other more common forms of migraines. And this actually has been disseminated to the bigger professional societies, such as the Occupational Medicine, Philippine College of Occupational Medicine, and the Philippine College of Family Physicians, because we want to reach a bigger network. So a big part of the upside of this pandemic is, I think, information and education has become something that is easily accessible by virtue of virtual means by which information and knowledge is actually disseminated. Next slide, please. So the other aspect by which we responded to the COVID-19 is actually by generating new knowledge. There's actually an existing current study. It's a nationwide study dealing with now 37 sites. So initially it was 31 participating sites. It has increased to 37 participating sites all over the country. Of course, you can see that it is mostly concentrated in the National Capital Region, mostly because of the density of the population. But you can see that we have representation as far north as Cagayan Valley and as far south as Davao and southern Mindanao. So you can see that we are going to look at the neurological manifestations of Corona and COVID-19, and we are looking forward to a publication by the end of the year. Next slide. So the lessons learned from this pandemic is mostly one, dire situations provide the best venues for creativity, resourcefulness, and unity. A big part of our resilience is, I think, our capacity to think out of the box. There was a time that face shields were not available, so we actually had to craft our own, and actually I was part of those. I was doing face shields in the house. I actually asked all my family members, including my children who weren't doing anything during the ECQ, to do the face shields, and we actually gave this out to hospitals and health personnel. The other thing is that people do not have access to transportation as such because of our quarantine limitations, and yet you can see health workers using their bicycles, even the most basic pediatric or children's bikes, just to go to work. And you can see the commitment that people have to helping others. Next slide, please. So what we have learned from this pandemic is that we work with what you have. Resourcefulness will always win. We always try to focus on helping others. That means that on our own, we had to provide protective equipment to our members, even to our hospitals during the times when we couldn't find any PPEs. We actually had to go to sewing circles. We provided materials for them to sew PPEs for our physicians, and we distributed them by ourselves because we're the only ones who are allowed to travel to our network of physicians. We always help others. And the most important thing is we always pay honor to those who have died and who have sacrificed, who have given their ultimate sacrifice, just so that the world will be a better place. So for them, we dedicate all of these efforts. Next slide, please. And we always want to reach out to our friends, our nurses, not just in the Philippines, but all over the world. They have been doing everything to stem this pandemic. And I think that's the most important thing. We can only call them angels on earth. Thank you very much for your kind attention.
Thank you so much, Dr. Pika, for the presentation. So guys, we have now heard from all four of our panelists. It's time for the 15-minute Q&A session. So as a quick reminder, there is a Q&A button at the bottom of your Zoom screen. So you can click on that, enter any question that you may have. If you don't find it, just type it in the chat and I'll be able to see that. So there were already a few questions that were asked by participants throughout the presentations. I see that panelists have already written down their answers, but just to make sure that everyone actually benefits from both the questions and their answers, I'll ask our speakers to just in 30 seconds or so reiterate their answers. So the first question went to Dr. Finkelstein, and it was about the fact that the highest percent of migraine patients is with younger women in the workforce. So Dr. Finkelstein, can you just talk a little bit more about that?
Yeah, I mean, I'm an economist, not an epidemiologist, but certainly the data are compelling that women in general and young women in particular tend to have higher prevalence of migraines, and they think it may be hormonal. Lots of hypotheses. I can just tell you that it's true, and it's true in Singapore, and it's true across the world that young women tend to be more at risk for migraines.
Awesome. Does anyone else of the panelists want to add something there? No? All right. So the next question went to our first two speakers. So you again, Dr. Finkelstein and Dr. Cheng. So how do each one of your studies differentiate other form of pressure headaches with migraine specifically?
Yeah, so that's a good question. And I think the simple answer is there's a screening tool that's available that can differentiate migraines from other types of headaches. So in our survey, participants were asked the screening tool, which asks about types of headaches. Do they occur on one side or both sides of the head? Are you sensitive to light? Do you get nauseous? So the types of questions that we think differentiate migraines from other types of headaches. I think the reality is we probably weren't perfect, and there may be some people with other types of headaches who were in our sample. But in my response to the question, what I said was, our survey was really aimed at getting at the unit cost in terms of medical costs and the work loss and the presenteeism. So if other types of headaches mirror migraines, we would assume the unit costs are probably the same. So from my perspective, if we miss some, that's fine. Because the costs are the same and our prevalence comes from other sources, and the prevalence data tend to do a better job of classifying the different types of migraine. And so as long as the prevalence data was accurate, I think our unit costs are also accurate.
All right, thank you very much. Thank you very much. So I'm really sorry, guys. I've just been let know that we are a little bit behind schedule, so I've been asked to move along with the Q&A. The Q&A box is open. Everyone, is there any last comments that you'd like to add, Dr. Finkelstein, Cheng, Alia, or Picard, before we move on?
Nothing further for me.
Sounds good. Well, thank you very much, everyone. Thank you very much to our panelists. I'll now give the floor to the second panel.
Thank you, Julian, and hi to everyone. I'm Dr. Gia Sison from the Philippine College of Occupational Medicine, and I'll be your moderator for session 2 in terms of the way forward in the new workplace. So earlier, we flashed a poll, and the question was, what are the key challenges you face when working in the new normal? So it seems that 49% are finding are actually encountering challenges in stress, burnout, and mental wellness issues, which I think is about time that we should start talking about. Thanks to all who answered the poll. So previously we spoke about the key challenges that affect the workplace, including migraine, and early solutions on how we can mitigate this impact. We also talked about studies in Singapore and Malaysia and in the Philippines on the impact of migraine on the economy. So to add, a study on the impact of migraine in the Philippines also showed that 51% of employees were reported to have migraine, and 14 work and personal days were actually lost due to migraine over a 3-month or a 90-day period. Now, on this session, we now take a deep dive into innovative ideas, initiatives, and programs that can help employees manage their health. So we have invited business leaders and HR leaders to share their perspectives into how we can enhance employee well-being and build healthier workplaces. So let's kickstart the session by inviting Azrul Mod Khalid, who is the Chief Executive of Galen Center for Health and Social Policy, Malaysia. And he will present Breaking the Stigma around migraine in the workplace. Take it away, Azrul.
Thank you, Doctor. Ladies and gentlemen, good afternoon. Allow me to thank the Progressive Alliances Towards Health Workplaces for the invitation to speak today, and Novartis Corporation for this opportunity to share with you some of the work that the Galen Center for Health and Social Policy has been doing on migraine in the workplace in Malaysia. Next slide, please. So is there a migraine stigma in the workplace? The short answer is yes. Migraine in the workplace is in plain sight and is often silent, which is why the working title for the Galen Center's handbook on migraine in the workplace is Silent Pain. Stigma, which is defined as society's tendency to minimize or discriminate against characteristic trait or disease, can lead to prejudice, discrimination, loss of status, and devalues one's identity. I don't believe that it is possible to overestimate the role of stigma on migraine and migraine sufferers within the context of the workplace. Stigma is the reason why many remain undiagnosed, the reason why many sufferers are unwilling or unable to access proper treatment, why many are forced to leave jobs or walk away from opportunities of employment. It's also why migraineurs suffer decades or even the entirety of their lives without treatment and care for their condition. Stigma is both a negative consequence of migraine itself and a barrier to care because it affects how we seek and access care. It is central to the issue of migraine. Despite this, and an estimated 9% of the adult population possibly suffering from migraine, there's often a deafening silence on providing support to them within the workplace environment. People with migraine do their best to hide their attacks because they fear discrimination or demotion. Episodes of pain are often treated lightly, the condition trivialized or even ridiculed in some extreme instances. Migraineurs could be branded as slackers, malingerers, and even incompetent by colleagues and supervisors. They could be labeled as unproductive, delicate, sensitive, leading them to be categorized or boxed, deemed unsuitable for certain work, left out of promotion exercises, opportunities, and training. Fact is, institutional discrimination with regards to migraine exists. Even from a gender perspective, stigma in these spaces can shape how women and men experience and respond to migraine differently, and much of this is due to how pain is perceived, tolerated as an occupational hazard or rite of passage. The culture of machismo in not looking weak or vulnerable is a disadvantage for men, and is a significant obstacle for them seeking assistance and treatment. Next click, please. Women who generally have better health-seeking behavior may also avoid doing so in an effort to not be profiled as weak, vulnerable, or supposedly allowing personal issues to interfere with work. You do not want to be judged or misunderstood, and you definitely do not want to lose your job, so you become silent. Next click, please. It is a fact that migraine sufferers often penalized under existing workplace policies which monitor staff absenteeism, sick leaves, productivity, and performance. Next slide, please. So what remedies are available? Well, if you look at the 2013 study, of which the graph you have here, which is a finding from that study on stigma with episodic migraine, chronic migraine, and epilepsy, patients indicated that those with migraine reported greater inability to work compared to patients with epilepsy. So we look at ability to work as the strongest predictor of stigma as measured by the stigma scale for chronic illnesses. So knowing this, what remedies are available? Next click, please. Unfortunately, as far as we know, most workplaces in Malaysia have inadequate or do not have at all occupational or human resource guidelines managing migraine, the consequences of which we have seen in the earlier slide. If fortunate, treatment may be covered under employer-provided healthcare insurance coverage, but in general, within the workplace environment, most resort to not seek treatment or use over-the-counter medication such as paracetamol, aspirin, and ibuprofen to self-treat. So the inadequacy or the nature of these stopgap measures often means there is a loss of productivity, presenteeism, absenteeism, and as a result, sufferers are vulnerable to human resource interventions and even disciplinary actions. The worst case could even lead to the dismissal of the individual from employment. Having personally witnessed and even sat on a domestic inquiry related to a person suffering from migraine, I can say that there is a definite lack of understanding and tolerance from employers, but also sufferers themselves, and of course, the general public. I think it was mentioned just now during Dr. Alia's speech, as well as some others earlier. Unlike countries such as the United Kingdom, which has the Equality Act, and the United States, which has the Americans with Disabilities Act and Family and Medical Leave Act, legal protection for employees on this issue in this country is arguably still at infancy. Therefore, there must be an effort to invest in changing the workplace landscape to recognize, be more supportive, and focus on improving the well-being of workers, as well as ensuring adequate treatment options. The debilitating pain of migraines, which is often unseen and hard to measure, means that existing human resource frameworks may be inadequate to the task. The fact is that as a result of stigma, people are slipping through the gaps of services, treatment, and support. Next slide, please. Next click, yeah. Next click, next click. And next click, yeah, thank you. So during the course of developing our handbook, our conversations with various respondents, which you can see here, has led us to discover positive developments, which are opportunities really for change and deconstructing of stigma and discrimination towards sufferers. What is clear here is that investing in creating more supportive environments, such as adjustments of work from home policies, work time, not only helps in reducing stigma, it actually helps improve productivity, increase loyalty, retention, attract talent, and increase performance. The role of the employer in this case is critical in the business case for an effective migraine response. Employers, as was emphasized by earlier speakers, taking their employees' migraine attacks seriously can help mitigate its impact on their work. They are often the key to helping people with migraine manage their working lives. So the approach that we are currently advocating in the work that we're doing right now for this particular issue is for employers to adopt an approach that is based on what is called the 5 Rs, which are themselves adapted from mental health strategies. So we have recognize, recover, return to work, remove stigma, and resilience. So you look at recognize, educate, and inform. So knowledge and acceptance are powerful tools for reducing stigma. We know this. However, it can be hard to know where to start. After all, people with migraine experience it differently, but introducing an employee-focused migraine education module as part of a workplace education process and development is a good first step. When it comes to recovery, once you're aware of an employee who gets migraine, it would be good to discuss it with them to get a better understanding of their symptoms, frequency, and triggers, and what those are, and to provide that reasonable time for the person to be able to get a proper diagnosis, have access to treatment and care. Return to work. Now, the focus of these strategies should be centered around the objective of getting the employee treated, recover, and for them to be productive, setting, of course, realistic goals and expectations. So employers need to be able to be ready to ask what employees need so that reasonable adjustments can be made, such as work from home, flexible work hours, and for medical appointments, and perhaps even physical changes to their workspaces. Removing stigma, and this is something that you need to be able to have in place within this response, where modules which allow for both employees and management to learn and help reduce fear, stigma, and discrimination in the workplace. But really, when it comes to this issue, it must start from the top. The understanding must begin from the upper levels of management. And finally, of course, we have building resilience, in which we need to be able to audit our institutional structures which are in place, or introduce reforms which move away from those punitive policies mentioned earlier, which may unfairly punish migrants through performance systems which are heavily dependent on staff absenteeism, sick leaves, productivity. So it's important to look at these issues as a way to move forward and for us to learn from what has already been done in other countries and to see what we can apply them here. Next slide, please. So the issues highlighted and the recommendations made earlier, does it mean though, and this I must stress, that people suffering from migraine will never struggle at work again, or that they won't encounter issues at work because of it? It is very likely that there will be existing employees on top of new employees that come in, which may have to struggle through migraine. But it's important for us to have these structures that are able to build resiliency within the organization to be able to address and help such individuals. So we've heard of people whose lives have been transformed by a supportive employer. I mean, that there is now interest and moves towards developing supportive, non-discriminatory work environments where employees feel that their condition is understood and taken seriously. And this would mean that they would be able to be open to talk about the impact that is having on them and to lead a discussion on how best to manage it at work. So this discussion must occur within the workplace workplace environment. So I want to just end my presentation here to emphasize on low-hanging fruit, that we'll be able to see what we can do today. And you have here that employers are today able to tackle migraine stigma in the workplace already as it is, with very little that they need to be able to do. So one of the things that we would encourage employers to do is to introduce an employee-focused migraine educational program as part of workplace education and development. And this is something that there are ready-made modules that are already available. And this is one module that the Galen Center is currently developing and hoping to be able to launch very soon. Provide training for management, human resource, and occupational safety and health personnel. But most importantly, to be able to support employees in terms of how they're going through this very challenging condition, and perhaps even allow them to go for support groups sessions which may be external of the workplace environment. So this kind of support needs really to be done. But there are also additional steps that can also be taken, which are much more systemic and much more policy related. And this is inclusive of the fact that migraine should be included as part of occupational safety and health and human resource policies and curricula. company policies should be able to evolve to reflect understanding regarding healthcare and employee care. With cases being brought for arbitration and judgment that have their roots in migraine, briefings with officials of the Industrial Relations Court may become necessary, really, to provide better understanding, fairness, and justice. And of course, at that last point that I wanted to put here is concerning reviewing existing employer-provided insurance and see what level of coverage for migraine treatment is provided, if any. Now, the thing is that all this seems to be very difficult. These are very difficult conversations to initiate, and they are, and we have to have these. But we must remember, though, that the lives and livelihoods of workers living with migraine depend on changes being made. So we can and must do better when it comes to managing migraine stigma in the workplace. With that, I thank you for your attention.
Thank you, Azrul, for talking about stigma, resilience, and how important it is for the workplace to be able to render support to their employees to address that low-hanging fruit that you have talked about. And so we all know that COVID-19 has caused far-reaching effects on employee well-being, and it has changed the way we should approach work. And up next, we have Dr. Ethan Lim, who is the head of the Clinical and Wellness of Cigna Singapore. And he's going to present ways on how to adapt to the new normal and new ways of working. Take it away, Ethan.
Hi, can you hear me? Yep. Okay, so good afternoon, everybody, and welcome from all around the world, and especially in the region, from Philippines, Malaysia, Singapore. It's my pleasure to be with you here this afternoon, and thank you to the organizers for having me to speak to you about COVID-19 and the new norms in workplace health and how this can potentially change the way we see workplace health, the workplace structures, and the way we go forward in the things that we are doing in 2020, 2021, and beyond. So, next, please. Next, yeah. So just a brief introduction about myself. I'm the head of Clinical and Wellness in Singapore, and also the medical director, and I look after the medical and clinical governance in Cigna in the Singapore market, as well as we look at health and wellness initiatives that is oncoming and that can help serve our clients and members a lot better, especially in these very disruptive times. I think it's important to pay attention to how things are changing and how we can look ahead to serve the community a lot better in terms of promoting better health services and promoting better health practices as well. So totally this entire 10 minutes that I'm going to spend with you will be very different from the previous speakers and previous talks. I will be speaking a lot about how we can have, we have dealt with it in Singapore, especially in Cigna Singapore specifically, with how we have coped as a company in Cigna Singapore, but more importantly also how we have actually helped our community, our members and our clients to cope with the stress and the changes of the things that have been coming on in the past few months. So I think this will be something that will be quite different, and I think coming from the perspective of an insurer and a health services company where we are the payer in, and I feel that we are the enabler in a lot of these health services, and we help to build up the ecosystem that actually enables a lot of these services to be in the right place for the right people. I think this is something that will be quite interesting. Next slide, please. So we will talk a little bit about the impact of COVID-19, how we coped in Singapore, how we are helping others people to cope and looking beyond 2020. I also like to highlight this thing about BC and AD. I think really COVID-19 is such a big disruptor in our lifestyles, the way we live, the way we work, the way we see ourselves, the things that are important to us. So now BC is known as before coronavirus or before COVID-19, and AD is known as after disruption. Okay, so I think it just shows how big a change in our life has been. And I like to point at these two pictures in Singapore, and it just shows you like before COVID-19, you know, we could have large gatherings, we could have fun activities, we could have all these things that will help enable people to bond, to be familiar with each other, and to be able to come in contact with each other. I think previous speakers have spoke about how to keep in touch with each other. And I think this is something very important and we would like to emphasize as well, especially with COVID-19. You will realize in many countries and many places around the world, large gatherings or social gatherings are not possible anymore. And there are certainly a lot of restrictions. And this will actually mean that people need to pay more attention to being with each other, checking in on each other, making sure that people are okay. And this applies not just at the individual level, but also at a corporate level or between organizations as well. So next slide, please. So I'd like to bring the attention to this. In Cigna Singapore, we have also highlighted something that globally we have brought this out. This is a global impact study for COVID-19 that Cigna as an enterprise has done. It is a survey we did in 16,000 people, and it was conducted between January to June 2020. This is actually a series of surveys that we have been doing on a yearly basis since 2014. But in 2020, we realized that because the huge impact that COVID-19 had on health services, workplace, and the stress that comes with it, we have actually put the focus on this year's survey on workplace health and stress onto COVID-19 and look at its impact on the workplace. And so the key markets that we really looked at was China, Hong Kong, Singapore, Korea, Taiwan, Thailand, New Zealand, UAE, Spain, UK, and US. And you can see that this is a very diverse market. A huge part of this, it's emphasis on the Asia Pacific region, but there was insights from all around the world as well. And this was actually a follow-up to the April study that we actually published then and in May. And now the July edition, which is continuation, just came out a few days ago. And this is we have both the global version and the Asia version as well. So some key highlights of this COVID-19 impact study is that we find that people are really talking about the new norms, right? We see this thing being talked about, and what does it really mean? We have seen that actually a huge number of people actually are finding that their life will never be the same again, as many as 20% globally. Right? And this actually ranged from 26% in Singapore, or 1 in 4 people, to China, which is surprisingly the least pessimistic about this. And only 5% of people think that life will go back to normal again. But I think this also has to take into context the local situation, right? Because you look at what people in China are doing, they are actually a lot more used to virtual meetings, virtual health, virtual services that are all enabled. And this means that they are actually at a state where they're very prepared for a disruption of this scale and this state. So that is why different countries and people and populations in different areas have found it quite different in the way they have coped and in the stress that they have to manage with. So if you look at the changes that COVID-19 has brought about, some of the biggest things also was that 40% felt that the biggest impact was on their financial status. And 37 thought that this future pandemics would also keep emerging and will be an impact on the financial health as well. And following closely to that was also physical and mental well-being. It's 36% of people feel that this had a huge impact, and going forward in the future, it will also impact how they have to look after their health in the physical and mental sense. We also looked at virtual health. So virtual health is where how health is delivered. And we find that 54% of respondents actually would like to use virtual health, and we'll find that they're very likely to use virtual health as an option for consultation or diagnosis. And globally, 17% of people were using virtual health during the pandemic, with China showing, again, the highest adoption, which was not surprising at about 27%. And the most popular use of these health services were really in, generic health support, so cold, flu, rashes, with 48% saying they were interested to use these virtual appointments in the future. And so that really showed how well it has stuck to them and how useful this has been. And also they found that prescription delivery was something that was very close to their heart as well. 40% said that they would continue using it for prescription delivery. So this is something that was quite important, I think, for a lot of telehealth companies. And we find that 39% would like to have mental health support. And I think this ties in very nicely with what all the previous speakers have talked about in terms of mental health support, support for migraine sufferers, for those with who's facing stigma at the workplace. And I think telehealth is also a way that they can come in to alleviate some of the stresses. And I think what is very important, I think, in this region and many parts of the world is availability of virtual health. I think that's still a main issue. As many as 35% of respondents have actually highlighted that they do not have access to virtual health services. And that is more than 1/3 of the respondents, and that is very significant. And I think that is where more work can be done and a lot more can be improved upon. The study also looked at the stress levels that were changing from this entire period from January to June and how people were coping. And 83% of people felt that they were still stressed in June. And this compared to about 82% in April. And you can see that the stress level actually still maintains quite high, because I think the important thing to notice with COVID is that this is an evolving situation, and with all changes and evolving situations, there will be a lot of changes because we are always constantly adapting. And that is actually very stressful to the human body and human mind. So we need to keep that in mind, that people are still being stressed. Even though it's been many months down the road, people are still finding ways to cope. The situation is still changing, and we need to be aware of this. Financials still continues to be a main cause of stress. It has been cited by more than 1/3 of people that they are still stressed at this period of time. There was a slight increase from April, from 31% to 35%, and work is considered also the second highest cause of stress at about 17%. This has dropped a bit from 21% in April, and we think that this probably is because a lot of companies have adapted and have actually put in place the workflows and processes that can enable people to work remotely or in very different circumstances in this COVID situation. So I think some of that stress has actually gone down a little bit from workplace and work, but it is still significant. And of course, working from home, there was a huge disruption in that. I think work from home, or WFH, is now a buzzword. Everybody asks, are you working from home? And I think this is a new phenomenon that is going to change the way we look and we deliver health and services in the workplace. And if you think about this, this is really a huge thing for most respondents. 60% of people, which is pretty much still the same from April at 61%, were still working from home, with 97% of those who had this option saying that it is something they would still like to make use of. So this is something that I think appeals to a lot of people. And the benefits of working from home, it's people feel that the day is more flexible and they can have a lot more to structure their work and their lives around it. But at the same time, of course, we recognize there's also a huge burden in terms of how people are also blurring the lines between home and work, and that is also leading to some stress. So these are all things that's important. Loneliness was something that was surprisingly not a huge stress factor, and we find that people actually felt closer to the people with them. And of course, this may have something to do with the fact that globally people are all, stuck together at home. And so I think this is where we would emphasize that support in this area is still important, but we can look at battling this. I think where this study comes in very handy for a lot of people is that it is where the study has enabled us to look at many things and many options, and also highlight the impact, but also possible solutions that we can do in the workplace, and employers and companies can think about how they can help their employees and staff work better and have better health. So if you're interested in this, feel free to reach out to me and I can pass you a copy. This is freely available for download as well. Next slide, please. So really for Cigna Singapore, we just focus a lot on how we dealt with this. We had a huge focus on delivery versus FaceTime, and we had a really informal, flexible work arrangement. So as you can see, we had frequent communication in COVID situation with frequent check-ins. We looked at how we can help our employees employ better healthcare, sanitization. We distributed disposable surgical mask sanitizers, gave out resources and tips on how to be a productive work from the home environment and how to manage the new norm, like coping with your children, staying fit during the work from home situation. And we had many global challenges and global resources along the way as well. Yeah. Next slide, please. And you can see this is some of the things that we did. We had communication with our staff as well, with our internal staff, and the resources that we helped our own employees with. And there was also a health and wellness kit that was sent to all our employees to help them cope. And here you can also see that we have group activities and bonding activities. Although it was done online, I think everybody enjoyed themselves very much. Next slide. And I think where it was important is also seeing what employees would want and where we could help them. So keeping staff fit, healthy, and on the go. So we had all these challenges and the goal to help people keep on track. Next slide, please. And I think more importantly for clients, members, and the community, where we had also kickstart a few campaigns like how to check in. So we have had an international campaign stressing the need for employers, for staff to check on each other, to look after each other, but also to visualize care in our Stress Care 1.5 campaign. We also gave out, we also started a free COVID-19 advisory service for people who are looking to go seek healthcare in these disruptive times and they don't know where to go. And we have plenty of other health and wellness resources and well-being resources for the market as well. Next, please. So this was a web page of the Stress Care 1.5 campaign, where we actually encourage people to see stress very differently, enable them to have a very visual feel of how stress and how it impacts their life. And we also come with a toolkit to help them seek solutions and help to manage their own care and stress better. Next. And this was a check-in campaign where we actually came out and we had people checking in on each other, how to do that as a company, how to do that as employees, and how to actually be much better at making sure that people are actually still doing well and not falling behind. Okay, next slide, please. And so we actually also have virtual clinic service as well. So this was a telehealth service for all our clients and members, and we gave them this is part of the doctor advisory service, but we also, next slide, we actually expanded this service to the region as well, where we have expanded from Singapore to Thailand, Vietnam, and Malaysia, and in the future, Philippines and Indonesia as well. And I think what is important to note is that going beyond that, there is a lot of health initiatives that we can do in the workplace, and also like screenings, vaccinations, and such, that we can also deliver in a decentralized version. Because now that workplace and work arrangements are all decentralized, I think companies and HRs have to think a bit smarter of how they're going to deliver such health services to their employees as well. So I think workplace health is going to be very, very different. So helping your most important results in your staff and your people will take a bit of a rethinking and retooling. If you'd like to know more, you can always contact us at infosingapore@cigna.com. Thank you very much for the time, and sorry it's been very rushed because I think we're very behind time. So I'll pass it back to the moderator. Thank you.
Thank you, Ethan, for presenting the impact of COVID-19 on the workplace. And so up next, we'll be talking about leveraging technology for a healthier workplace. And we have Jonathan Dixon, who is the head Enterprise Business Segment, Asia Pacific and Japan of Amazon Web Services. Take it away, Jonathan.
Good afternoon, and to Novartis, thank you so much for the invitation. And to everyone that's joining today, best wishes to you and your family and your close ones around the world. For myself, I lead a team spread across Japan, Korea, Southeast Asia, Australia, New Zealand, and India. And it's been a big challenge for myself with a family spread around the world, and then also, hundreds of people that I'm responsible for to ensure that we all get together and work together and really focus on the things that are important, but at the same time, trying to keep in a good mental state. So it's a real privilege to come and talk today. Look, I mean, a lot of the messaging I've sat in and listened to some of the speakers has been covered. And what I really want to talk about is how technology is actually helping organizations get through this. And what I've seen, the enterprise for AWS is all the traditional industries you think about. So financial services, travel, transportation, manufacturing, telecommunications, automotive, and immense challenges throughout this time has brought about incredible innovation. And faced with disruption, companies are responding and rebuilding. And we've really taken a long-term approach around helping our customers to do that. And it obviously varies per industry. Obviously, we'll talk a little bit around how we're helping from a health life science perspective today. But I'll also provide some insights into the culture of Amazon, and I suppose why we take such a long-term view with our customers, and why during such challenging times, we seem to be helping across a number of ways, and there's some best practices that we're seeing across the region. Next slide, please. So I'm not sure how many people have had much to do with Amazon Web Services or Amazon. Amazon Web Services is the #1 cloud provider in the world, based on market share, based on the number of customers, based on the number of partners, based on the breadth and depth of our capability and stability and pace of innovation. But Amazon itself is a very peculiar company. It's really very, very innovative and continues to reinvent themselves across many different industries and services that they begin building in. And we have a very, very strong vision that was created by Jeff Bezos, our chairman, our founder, and our CEO, to be the Earth's most customer-centric company. And that sounds ambitious, but it's not that ambitious to Jeff and our leadership team. And as soon as we can find any sort of form of life beyond Earth, then we will be changing that to Earth's, to the galaxy's most customer-centric company once we can prove that there's other forms out there. But I just want to give you some insights into sort of the key parts of our innovation, our culture, that means that we continue to innovate on behalf of our customers. And as we all know, during this pandemic and during the new normal, and me being in my office today, and I'm seriously missing not jumping on a plane 2 or 3 days a week, I have done for the last 15 years across the region. There are some key reasons why we innovate and why we help our customers to innovate. So really important is that every customer or every organization really thinks about their end user and their end customer. And your end customer doesn't need to be an external customer, it can be an internal customer. If you have that mindset, that really sort of drives you in the right behaviors and ensures you're focusing on the right things. Again, taking a long-term view. And Amazon's been very good at that. We disrupt ourselves based on building for the long term on behalf of our customer base. And interestingly, within Amazon Web Services, 90% of all the services we've built are actually on the request of our customers, and the other 10% are based on what we think customers want, based on talking to customers and providing anecdotes back to our headquarters in Seattle. So again, there's that classic statement, be stubborn on the vision, but flexible on the details. And I tell my teams, be stubborn on your vision, but flexible on your tactics. And that's a really great way to think about how to operate within a business especially when you get these massive curveballs that we're all experiencing today. The other thing is failure. Failure is going to happen. So you need a culture that accepts failure, learns from its failure, and then moves on. So start small, iterate, be agile, and again, realize that not everything's going to be successful, but it's what you've learned from that and how you encompass those learnings and how you put those into process moving forward is really important. And again, if you're thinking about your end customer and you're experimenting, you're continuing to iterate on your end, based on your end customer's experience, that will generally hold you in good stead. And then finally, we are famous for being misunderstood for a long time, okay? And I'll give you some examples of Amazon. So, I mean, Amazon itself got really popular by selling books, and it was a very successful business. And then our founder thought that's actually not a very, very pleasing experience, especially if you go on holidays, you want to pack lots of books. So they built the Kindle, and the Kindle, obviously all these books located in this electronic device, is going to disrupt our traditional revenue streams. But again, Jeff had a vision that he wants to have the most extensive and best experience for his customers. So therefore, we're going to build products and continue to iterate and be inventive based on that customer focus. So there's some insights into our culture, but I thought would be interesting considering for people that aren't too familiar with Amazon as a company. Next slide, please. So the other thing people might not be aware of is our pedigree in the health life science industry vertical. So we have a vertical. Novartis is one of our key partners and actually customers, and that's been in place for north of 7 years, and it's across the globe. I talked a little bit about Amazon Web Services as a cloud provider. You know, we're 13 plus years in the market. We started in 2006, a long time before sort of any meaningful competition. And it's meant that we really can build at pace, and we love doing it on behalf of our customers. And I'll give you some examples of what we've been doing throughout this pandemic. As you can see, we've got tenured people that work in this industry. If you look at our customer base, the majority of the large health life science providers across the world work with AWS. And you can read those stats there. And we continue to work with big organizations around the world in three main areas. One is to help sort of modernize technology debt and get some efficiencies. Two is to help customers upskill their organizations so they can actually be successful in the digital world. And that's just not from a hands-on keyboard perspective, but that's also around how you think around new operating models in this new agile cloud world. And then finally, we help customers innovate and partners innovate. And that's really twofold. So that's looking at existing businesses or existing assets the customers have, and how can we leverage data and provide insights and make recommendations to improve the experience or get efficiencies out of these brownfield assets. And then secondly, how do we build new business models? You know, we're doing a lot of these with health life science providers at the moment around how to service their customers, how to do research and development faster and more safely. Similarly with a lot of other industries, so omni-channel capabilities for financial services companies, which has been really, really important during these COVID times. Next slide, please. Next slide. Okay, so really, again, I talked about this massive challenge, and we're seeing customers work with us in terms of three benefits or three sort of ways in terms of adhering or adapting to this new normal. And the first is the ability to rapidly change and meet these changing environments. Second is the ability to adjust to new restrictions while executing business continuity plans. For me and my teams, I had to quickly work from home. In addition, we also had a lot of teams at Amazon that needed to continue to work, keeping our data centers operating for our customers. So how do we keep them safe? And then thirdly, the ability to make quick recoveries after setbacks and capitalizing on opportunities. And realistically, the companies that went into COVID in a more digital fashion, they were able to adapt more easily versus companies that have been a little bit slower. Consequently, we've never seen, in the time that AWS has been alive, such an acceleration from business leaders around the plans to accelerate the digital transformation plans. So let me just give you 3 examples of what we're seeing across the industry. The first is close to most of the people that live here in Singapore, is Singtel, obviously the national carrier. Obviously, the Singapore government has put in a policy for everyone to work from home, at least for the foreseeable future. So we created Workspaces, which is a remote working software capability for businesses of all sizes, and you don't need to actually have your laptop. So you can come in via your virtual private network, and you can access your work environment securely from a remote location. And that's been Singtel is using it themselves internally, and then they're passing those benefits also on to their customers. Next slide, please. Okay, Doctors Anywhere is a pretty cool little company in Singapore. If you're not across them, we haven't come across them yet. But as we've heard today, more people are turning to telemedicine to obtain medical consultations and health services. And this is now becoming the norm. So Doctors Anywhere is a regional tech-led healthcare company headquartered in Singapore. And during the pandemic, they saw their requests jump by 3 or 4-fold, including how they needed to diagnose patients seeking video consultation. So we worked with them, we're able to meet the demand, and now they're continuing to do that across 1,300 clinics across the region in Singapore, Thailand, and Vietnam. Next slide, please. And then finally to Australia with the New South Wales Health. So another example. So New South Wales Health Pathology, they developed, working with us, an SMS solution that reduced the negative test results, wait times from 7 days to 3 hours, which is pretty impressive. And that really helped to relieve the anxiety for citizens and allows clinicians to dedicate more time to assisting patients who actually tested positive. And we've actually helped them automate from say the equivalent from 3 years in manual time. So that's been a pretty impressive sort of acceleration of capability. And also not dissimilar to what has happened with Doctors Anywhere, we've seen an 18-fold increase in the use of its video platform. So again, working with AWS has been able to scale in a stable and secure fashion to be able to see its capabilities. And then finally, Amazon Connect is a cloud-based contact center. So again, we're leveraging that to meet the rising demand for test results. And again, that's all from a work from home virtual environment, absolutely secure, scaled, and it's been very, very easy for the agents that are working with New South Wales government to actually learn about the new capability, provide a good service to their patients. That is it from me. Thank you very much.
Thank you, Jonathan. And indeed, we need technology to work for us, especially nowadays. Thank you so much. And for our next topic, we will talk about strategizing a well-being program for employees in the new normal. And with that, we have Marla Amal, who is the Senior Principal Asia Consulting Leader of Mercer. Marla, take it away.
Thanks, Dr. Jia, and good afternoon to everybody. A real pleasure to be wrapping up this fascinating session this afternoon. In my work where I lead a consulting team across Asia, designing or strategizing health and well-being programs is one of the areas that we consult against, which means that I do see a lot of organizations' well-being strategies. Having said that, I have not seen a large number of them that actually focus on migraine care support or recovery. And therefore, today's session for me personally has been quite fascinating. And I do wonder if this is the tip of an iceberg for us starting to see migraine care and support included in more well-being programs. As Dr. Jia mentioned, I will be talking to you today about what it takes to design a well-being program. For us, that's quite a consultative process. So rather than go through that rather comprehensive outline, I wanted to distill that to a few key tips and tricks that you can hopefully take away in your toolbox today as employers, as people who have influence over the design of these programs in your organizations. Before we do that, move to the next slide and take a quick look at what the different perspectives are that drive how an employee wellbeing program has changed over the last months. First of all, a very interesting statistic from employees. We know that 61% of employees trust their employer to look after their health and well-being in Asia. Interestingly, this is about 2 times higher compared to other regions like Europe, for example. So there's a great opportunity here to return that trust and provide that type of well-being support that employees look to their employer to provide. We also know that along that same vein of trust, that employees report being much more confident in taking up digital health solutions that are recommended by their employer, rather than going out and doing their own research or responding to the various promotions that we get in our email inboxes. They really do look to their employers to provide that guidance and filtering for them. From an employer perspective, actually only 1/3 of HR leaders have a health and well-being strategy. So we know that there's an opportunity there to increase that, and COVID has certainly accelerated that movement. Specifically, COVID has accelerated virtual events. One of the main activities that we see, in addition to telehealth, for example, is many of our clients and employers provide an annual on-site well-being fair. 1/3 of employers are now shifting that. They're not canceling them, they are creating well-being fairs. In the same way today's session might have been an on-site conference event, we're now doing it online. From a market perspective, we've heard during this panel before that telehealth has just exploded, in Asia even more so than other regions. That interestingly, one of the key drivers behind that is mental health. Not surprisingly, based on the statistics we've heard today, mental health is a huge burden and cost to employers. It's not quite as quantifiable as some of the work that has been done today, but we do have some reports to show that it can be 40 to 90 times the cost of expenditure on an employee assistance program, which many organizations have. It really goes to show that we need to have comprehensive well-being programs to support. Next slide, please. So if we look at the 3 critical aspects that are more important than ever to address with well-being programs, the 3 I've picked out for you today is, first one, providing support across a health continuum. I'll share with you what that means on the next slide. Second is integrating digital care solutions, which is very self-explanatory. What I'll do today is provide a few tactical examples of that for you. And the third is making your well-being program marketable. These days, it's not enough to have a great well-being program. If employees aren't excited by it, they're not aware of it, they're not engaged by it as if they were a consumer of the program, then you're not going to get the same impact or uptake from your program. So moving to the next slide of looking at the continuum of health that I referred to, typically we've seen in the past organizations focus on the well employees with our nutrition talks, with yoga classes, with step challenges, and they focus on the ill employees through insurance services or EAP services. Where we really need to shift the dial to is to look at this health spectrum broadly and be able to design well-being programs that support from an end-to-end perspective, from prevention all the way to intervention. And of course, digital is going to play a key role in how we deliver and provide access to care in this new world. Moving to the next slide, if we look at integrating digital care solutions into well-being programs, to give a few examples across that spectrum, for the well employees, we certainly don't see any limit on the number of activities that we ourselves could be engaged in on a daily basis. I gave a number of examples already, such as the step challenges, for example. There's organizations are implementing quite a large number of employee listening assessments. to get a sense of how employees are behaving, how employees are feeling. In the past, that used to be an annual employee engagement survey. What we see now are employers wanting to understand on a monthly basis, a weekly basis, or even real time, the extent to which their employees are feeling well and how well, what's driving that behind it. If we look at at-risk employees and the digital components that we can include, certainly telehealth and EAP play a really key role here to help to mitigate the chance that an employee would move to the ill category, or to make sure that if they are going to be moving to the ill category, that they are cared for appropriately to prevent moving to the catastrophic category. We see a number of services coming to light here where employees have access to treatment-specific on-site counseling, online counseling that helps them with specific conditions that they may have. If we move to the ill category, then again, going into a much more concierge style approach for supporting employees when they are at most need here. If we look at, although it wouldn't be considered ill, but if we look at, for example, maternity care as a bucket of somebody who would be receiving treatment here, there are a number of online services that have been created where employees have access to their own personal concierge coach throughout the maternity process. What we've seen as a result of that are the number of elective C-sections, for example, have gone down, and the number of visits during the course of antenatal care during a pregnancy has been much more close to the average rather than higher on the spectrum. So that really directly impacts the bottom line of what an employer is paying either for premiums or for care if they self-fund their maternity benefits. From an employee perspective, they get that concierge service and the employee experience is much higher. So their affinity and value and appreciation for the organization is also repaid in that regard. From a catastrophic perspective, we spoke previously around return to work. This is where one of the most significant impacts comes to the company or the employer from long-term disability or long-term inability to work. And increasingly, we see those return to work programs being implemented from a virtual perspective. Moving to my last slide, to how we make these programs marketable. I've pulled a few great examples from organizations that are already showing how they bring these health and well-being programs to life. On the left, and these are all across different industries as well. On the left, you see Johnson & Johnson. They've coined theirs Healthy and Me. In the center, you see Facebook's Life At program. And then on the right, you see a really lovely wellness program and campaign launched during COVID from DBS here in Singapore around the Together movement, really bringing employees together to support mutual care. I think we see typical cornerstones to what good looks like, having a particular brand. Each of these has their own color, their own brand, their own feel to it, and having slogans and taglines as well. All of that needs to be brought to life in a sustained engagement activity with your employees. And so with that, I will hand it back to the team and hope we have time for some Q&A.
Thank you, Marla. And for our wrap-up session, who will be talking about reimagining healthy workplaces in Asia, we have Leonhard Schates, who is the Novartis Global Market Access Director. Take it away.
Hello, can you hear me now?
Yes.
Yes, good. So yeah, I think my talk is bringing together bits and pieces of all the previous talks that we had heard. Novartis was on that learning journey of what migraine means for associates, and we understood more and more about that as part of our work as a pharma company. And at the same time, Novartis is a very caring employer, and we are actually having a very active well-being program to support our associates. So we have heard about the stigma, we have heard about the high impairment on a societal and on an individual basis, and we have heard as well on how associates lean actually on employers supporting their health. I just want to add one number here as well. When we made our math in Switzerland for Novartis, 12,000 employees, the cost of migraine to the company is 17 million Swiss francs a year. So that's roughly 1.5 to 2% of our total payroll, which we're having here. And when you hear on how we otherwise, what efforts we do in order to fix problems that cost us 17 million, then we thought we need to become active. So on the next slide, you basically see what we decided to do and kick off. Next slide, please. So we've heard, of course, increasing the understanding is a key pillar to overcome the stigma. And of course, it's an opportunity to support those ones living with migraine. But at the same time, facing the magnitude of the issue with migraine on the burden of the individual, but on the impact on the company, we thought we need to do more than just education. And so basically what we were looking for and tried to find, and Marla is right, you can't find it out there in the market yet, is a concierge service, coach style disease management support for those ones living with migraine, that then really based on a personalized coaching, and we have decided pre-COVID already to go for telecoaching to reach all our employees, including those ones in the field, to get doctor consultations and independent nurse coaching over a period of 6 to 9 months, really with the aspiration to find what works best for them, to bring them to their personal individual best. This one was supported by an app that allows self-monitoring, communication, reminders. So we really thought here we want to use the features of digital, but combine them with the human touch of a personal coach that really helps you to really drive the behavioral change and achieve this behavioral change. Ultimately, of course, access to therapeutic options is a relevant part to it, because how do you know when you learn that you need a medical option but you cannot get access to it? And so access to drug is, of course, an integrative part of this program, and we need to make sure that it's not only about identifying the best options for each patient, which can be medical or non-medical, but it's about really providing them with access to these options. Next slide. So on this slide, you can see a bit more in detail on how this individual coaching worked. It's all centered around the needs of the patient. We have worked together with the Swiss Headache Society and leading experts in neurology and digital to actually develop a set of 16. In the meantime, we are at more than 20 modules that really tackle what are the typical key challenges people face living and working with migraine, and then really identified coaching modules around it. And now if a patient or an associate to Novartis or a family member self-enrolls into this program, then really in the beginning, in the screening and the baseline discussion with the medical doctor and the nurse, really the key areas of improvement can be identified, which can range from attack management to regularity in sleeping and drinking behaviors, to how do I talk to my doctors and what options do I have for my medical treatment of my migraine. On the next slide, we can really understand that there is no one fits all, and people have different levels of severity of migraine. I think we have heard that from the pre-speakers. So if you take a nutshell, you have 1,000 employees, probably 140 around, depending on your gender split, might be living and working with migraine. Of those ones, And for many of them, actually, some education might help, but for probably 70 of them, half of them, or probably some more targeted support will be required. And probably 10 of them might need then really innovative therapies that are available now in order to manage migraine better, which then is really identifying the right intervention for the right individual, where again, an individualized coaching really became the choice that we went for in order to identify the right intervention for each individual. So when we look at what this program achieved on the next slide. So qualitatively, we have some key insights. What we have understood as well, and we were surprised, even at Novartis, where we are a healthcare company, 1/3 of the people haven't ever been medically diagnosed with their migraine. Similar numbers we have heard from a pre-speaker. So of course, then how can you manage your disease if you don't even know what your disease is? Key focus as well is about the empowerment of the patient, is where you could measure and significantly improved self-management of the associates, taking ownership of how to manage their disease. And what was very surprising for us, the program was 6 to 9 months and the adherence was almost 70%, which then shows as well that here, obviously, the patient have seen this great value because they stayed and stick to the program, which, as Marla said before, we need to have a program that is attractive enough for the associates, because otherwise it will not be used. But let's get some more numbers behind that, because it's not only about improving, but it's about hard outcomes. So what we could here see that the MIDAS, the Migraine Disability Score that was already referred to before, actually over the course of 6 months was reduced by more than 50%. And it was sustained and even further improved after the program due to the increased empowerment of the patients by 64%. So basically, participants could reduce the level of impairment of their individual migraine by almost 2/3 after the course of 9 months, which translates into 11 days more productivity at work, so full-time equivalent days productivity at work, plus, even more important from our perspective, as migraine very often hits people on weekends or even during their vacation due to changes in lifestyle, they gained 14.5 more private non-working days free of migraine. So that's almost a complete summer holiday that they got on the top of through this intervention. Which then ultimately, of course, shows you as well that for a company with 10.8 days gained in productivity, this is not only a great opportunity to support your patients and the culture and to show the level of care, but to show as well that a positive return of investment. And here now, well-being program can come from a cost center to a profit center. So wrapping it up on what is in this program that we have conducted for Novartis in Switzerland, the key outcomes is we have identified that it generates a very high employee satisfaction, and actually it's a differentiation from other companies, because people now talk and they say, oh wow, my employer has such a program and it really helps me. And this is probably 1 out of 7, 8 people in your company who will be thinking like this. From an occupational health perspective, we're achieving a dramatic improvement for a very precise health issue that really can help us to overcome one of the key health issues within the company. The employees appreciate this service because they really stick to it with 70% adherence. It's, at least for us in our programs for Europe, this is an incredibly high adherence rate. For finance people that very often might challenge HR and well-being people on the investment and what comes out of it, it's a great opportunity to show a high return of investment of this investment. So if you, every dollar that you invest into taking care of your migraine patients, actually we in our pilot get $5 back. If you need to include innovative access costs, then it's probably 1 per 2. So here we see that really migraine care should be an essential part of a modern well-being program in a company, because it works well for associates and for the companies. So this is the pilot that we have recently published as well in the peer-reviewed journal Headache, to finally show on the last slide similar programs and services and similar way of role modeling exists for Novartis in the countries that were that are mainly participating in this call. So from helping companies to assess what the burden of migraine is in your company, to provide ready-made plug-and-play tools that allow associates to self-educate and educate your entire workforce, to finally having targeted concierge programs that support people living with migraine and with access to innovative treatment options. All this one is role model in most of the Novartis companies in these countries, and actually these Novartis organizations are very happy to share these and the access to the providers as well. So thank you very much for having me as a guest from very far here in Europe, and I'm looking forward to the discussion now.
Thank you, Leo. However, unfortunately, due to because of the interest of time, we won't be able to hold our Q&A forum. However, we would like to thank all our speakers for your insightful thoughts and studies and everything that was presented. And to give us our closing remarks, we have Mr. Matthias Domineg, who is the Deputy Head of Mission from the Swiss Embassy of the Philippines.
Ladies and gentlemen, dear participants to this regional roundtable on reimagining healthy workplaces in Asia, good afternoon from Manila. It was my great pleasure to participate this afternoon at this very interesting webinar, and I would like also to thank all the speakers and to commend them for valuable inputs from different countries, inputs that are both timely and relevant for practitioners, staff, employers, and business sectors. Allow me to excuse Ambassador Alain Gachen, who was foreseen to speak here. He was, due to unforeseen circumstances, on short notice, he had to attend to an urgent matter. He sends his best regards and thanks you for your understanding. Excuse me also for the rather improvised nature of my intervention here this afternoon. As you may know, health is of particular interest to Switzerland. We attach great importance to a sophisticated health system who is improving and securing the quality standards, quality of life for our citizens. And Switzerland is also home to some of the biggest and the most innovative pharmaceutical and biotech companies. I'm very thankful to observe, and especially over the course of the last months and in response to the pandemic, how these companies, and we have Novartis as a prominent example, have been working extremely hard, not only to cater to cater for the current needs and the demand for life-saving drugs, but also to share their knowledge and to foster partnership with different government entities and stakeholders to come up with effective solutions to the problems of our times. This conference is a brilliant example of a collaborative effort, private sector, academia, government, civil society, a multi-stakeholder approach which we value and praise. Let me share some of my notes or takeaways to this from the highly interesting presentations. First of all, and this is important, I think that through the pandemic, health has rapidly become preoccupation number one for all of us. COVID-19 has caused far-reaching effects on employee well-being and change the way we work. I think we've heard it from Dr. Lim. We don't speak about ACDC, but BCAD, so before COVID and after the disruption. We all have realized the duty of care, which is not only a task for human resources personnel and responsibles, but also for the top management. employers taking responsibility for health of associates is the right approach. This roundtable highlights that there are multiple health issues, and we have talked and heard quite a lot about migraine, which affects the employees in the workplace, and which brings out the need for more awareness and action to mitigate these issues. The COVID-19 pandemic has shown us how vulnerable our societies are, and governments, of course, have to come up with effective responses. The pandemic has also reinforced the role companies play in protecting their associates from health threats. We all realize that the learning curve might be steep in adapting to the new normal. It's even, we were surprised that some companies or organizations have become even more efficient than in a normal work circumstance. But of course, this comes with certain risks, and we have heard this afternoon some examples of risks. Staff need to have a balance between work and life, work and family. Kids are not able to go to school, which is so vital for their development. We are also, of course, social beings. We need the interaction, the contact with colleagues as an organization to grow. And while safety at the workplace remains of importance, the well-being has become of vital interest. This comes, of course, with great responsibilities, but I would also say with great potential. Many sectors can contribute to it, and we've heard of opportunities in the IT sector, web services, telemedicine, and telehealth. And we have seen many examples of creativity, of thinking out of the box that has led to win-win situations. This roundtable also underscores the importance of the role leaders and employers play in managing the health of their associates, and this needs to be part of every company's or every organization's internal strategy or social responsibility. Allow me to mention one example from Switzerland on how to foment a movement to create healthier workplaces, which is also the motto of this afternoon's webinar. The Swiss State Secretariat for Economic Affairs, together with the Swiss Federal Office for Public Health, have supported the definition of quality standards in order to certify companies as so-called friendly workspaces. Criteria, for example, are the integration of workplace health management in existing management systems, or the creation of personality and health promoting working structures, and the promotion of healthy conducts, which need to be improved constantly and over time. In short, it's about integrating health criteria in existing quality processes. This is, of course, a process that requires the involvement of many actors. And of course, as Swiss, we like such multi-stakeholder approaches, taking everyone on board. This is, of course, as we heard, also a chance for the organizations and the companies. Collaboration is key in discussing perspective, recommendations, and constructive solutions to work towards building a healthier and more resilient workforce. And you have all made very important contributions towards this aim. And I would like to thank you on behalf of the Swiss Embassy and as one of the co-organizers of this event for all the inputs and great examples, lessons learned that will surely lead to more win-win situations in the future. I'd like to thank you for your attention and for this very interesting conference this afternoon. Thank you very much.
Thank you, everyone. I think we have come to the end of the virtual roundtable. I think it was very informative. I think I really like to thank all our experts, our speakers. We will also continue. We hope that such kind of conversation continues to happen. And with that, let me again just thank you all for being a part of this lovely conversation. All the delegates, all the participants, and all the experts who took the time out to join us today. Thank you, everyone. And we will be in touch with all of you in the coming days as we prepare the report from today's webinar, as well as for other materials which we will be sharing with you. Thank you, everyone.